I actually applied directly to the labs for an MLA job, so a medical laboratory assistant job, which came with doing the degree apprenticeship. However, most people and nearly all other staff, you need to have a band 3 or band 4 job within a laboratory, and then they hire internally for the degree apprenticeship. The healthcare science, infection sciences degree apprenticeship that I've done leads you to be a biomedical scientist. So you get your biomedical science registration through the HCPC as part of the apprenticeship, which I think is really important because that means you can apply for biomedical science jobs now without having to do that trainee part, which is really crucial, and it really differentiates you because it can be really hard to get your registration portfolio if you haven't done it through university because of work pressures. So from now I can apply for biomedical science jobs, and then I will specialise in an area that I choose. I've had a lot of family who've worked in the NHS, so I've always seen it and it's always been part of my life growing up. And when I was at school, my science teacher was a biomedical science before, and that really interested me, and then that's why I've done biomedical science as a career. It's hard work. It's hard work, but it's worth it. You really feel like you're making a difference, especially with COVID and the pandemic. Working in virology, I think people have really started to notice what impact you have, and nearly all patients that come into hospitals, the laboratories provide them a diagnosis. So you might be referred to a doctor or a consultant in some area, but inevitably most of them refer something else to the laboratory, and that's how they get their diagnosis. You've got to be really hard working. It's hard work. You do a full-time job with a full-time degree. So my degree was 4 years alongside a full-time job. So they did stretch the degree out slightly, but it also included extra things such as your registration portfolio and a pandemic. So yeah, you've got to be really focused. You've got to put that time aside, and it is hard, but it's been such a good experience, and I think it's so worth doing the apprenticeship route than it is doing it full time if that's more suited to your lifestyle. For me, I was a bit older than university, the average age, so it just wasn't really for me to go back to start from university. So doing it alongside work, it meant I could earn some money and I gained so much experience, and I really think that the degree and the job work so well as an apprenticeship. So there's a high turnover of staff in the NHS because there's so many jobs, so there's always going to be a job. I think what helped me get my post was that I'd worked in other areas of the hospital, so I'd been a receptionist, I'd worked in admin, I'd worked in little areas, and I think that really gave me the insight into the NHS. And when I applied for the medical laboratory assistant job, I had a lot of experiences that I could draw on, but I think you can get a lot of jobs and you can also get a lot of work experience. I did some work experience when I was younger through school, but I did that at the hospital as well. So there's always going to be areas, and there's always volunteers at hospitals, so you can always do that. But I think even volunteering at charities and things that are similar, I think that all will add up to experience that you can pull from in interviews. So the course was 4 years, and you had 20% time was dedicated to study. So a lot of hospitals do that differently. I was given it a set study time, and that 20% of my year that was dedicated to study. So that might be during work time, or it might have been at home studying, doing the university side of it. It's a 4-year degree, and you work full time. You have to work a minimum of 30 hours to qualify to do the degree apprenticeship for healthcare science, the biomedical science route. And I think that it is quite full on. You get a lot of work. You do get some slight summer breaks and Christmas breaks, but often they're followed by an exam period. So yeah, you have to be prepared for a lot of work, and there's a lot of work managing your time and organising yourself, which when you've got other commitments it can be tough, but there's a lot of support, especially Staffordshire University. They were really helpful. They're always there to answer any questions you might have or answer emails. They'd answer emails at all times. That they were really great and very supportive. And then you're also assigned a workplace mentor, and that's someone you can go to or help guide you through, and they always helped me with university work as well as things that was happening in the workplace. You get to work alongside professionals in the area that you want to go into, and you can learn so much by doing the job every day, and I think that really sets you apart from full-time university students who get a different type of experience and different type of learning. I found the degree was very much tailored to the job rather than the degree on a whole, and more, it was very patient focused. Disadvantages of the apprenticeship are that you don't get to necessarily have that full uni experience, but I think if it's what you want to do, you get paid to learn, and it's great. My role is I'm an associate practitioner in virology, which comes under the microbiology infection sciences area of the laboratories. A typical day for me, we normally get rotated a particular task for each shift, and that could be booking samples into the lab, assigning them tests that they've requested, running analysers, helping sort out stock for the laboratory, assisting other members of staff, or it could be training others. There's quite a lot that comes under it, really. There's a lot of tasks you could be doing. We interact with a lot of the consultants, or we get a lot of phone calls from clinics, including the sexual health clinics or those within the hospital. We don't generally speak with patients, so we're not really a patient-facing department. I know other departments such as haematology, the people who work in those laboratories, they actually go out to clinics and speak with patients and interact with them. When the pandemic started, I was heavily involved in the COVID testing, so yeah, things went pretty hectic at the start. I mean, everyone was trying to work out what we were doing, how we were going to do it. With the mass influx of screening samples, we were running them in our molecular laboratory where we do all our PCR testing, which is now quite a commonly known term. So we're still running them, and we're still really busy because the hospitals now, the operations and elective surgeries, they're all increasing, and everyone needs a screen before they come in. People are needing regular screens once they're in hospital to make sure that they don't become infected. So that was my main role for the past year. And then once the antibody test got introduced, I actually verified that and got that set up, and we're still running those now. So screening people for COVID antibodies. I think that healthcare science is so important within the NHS because the laboratories, for instance, they diagnose most patients that come into the hospitals, and without that we wouldn't know what was wrong with patients, how we can treat patients. There's so many things that make it important, and it might not be so commonly known, but it really does keep everything going. So it's difficult in virology to say what the next thing will be because we're currently very COVID focused still. So at the moment, the new things for us are COVID screening is joining things that we'd normally screen for just flu and RSV. We are now getting flu, COVID and RSV screening kits that are coming into the laboratory. So it's joining all our respiratory panel tests. So it's just showing that it's going to be around for a long time, and it's going to become the normal thing that we screen for. So for my university project, I implemented the COVID antibody tests in our laboratory, which now is used to screen. It screened all the staff, it screens patients in the community. So I know that every time a test comes in, it's me who's verified that kit and made it ready for use, and it's being used still, and it's, yeah, I was proud of doing that.